the virus spread across West Africa, ultimately killing more than 11,000 people. I first traveled to Guinea, where the outbreak started in April 2014. By that time, the virus had spread to neighboring countries Liberia and Sierra Leone, and more than 100 people had died. These patients are fighting one of the deadliest diseases in the world, Ebola. It has disarmed their immune system, shut off their blood's ability to clot, and invaded the organs in their body. Up to 9 out of 10 patients will die. By June, the death toll was up to nearly 400. But it wasn't until an American citizen named Patrick Sawyer collapsed after getting off a plane in Nigeria that the international community really started to pay attention.
Sawyer was quarantined upon landing and died just 5 days later. But what about all the passengers and the crew on Sawyer's plane?
A few days after Sawyer's death, a second American, Dr. Kent Brantley, tested positive for Ebola in Liberia. Another aid worker, Nancy Wrightball, had also been infected. Both were given an experimental drug called ZMapp and flown to Emory University Hospital in Atlanta, Georgia for emergency treatment. He's the first patient infected with the Ebola virus to ever set foot in the United States. Medically, scientifically, historically, this is a first. Their arrival sparked fears that the virus would spread as quickly in the United States as it had in Africa. Why were we so afraid? Well, because the virus was following the plot of every horror movie made about a deadly global epidemic.
It's even worse than I had feared. Every day this outbreak goes on, it increases the risk for another export to another country.
Then, a hypothetical nightmare became reality. A man from Liberia, who didn't even know he was sick, landed in Texas, coming in contact with 48 people before being quarantined.
Officials from Texas Health Presbyterian Hospital are facing a PR nightmare. The Dallas hospital is at the center of the Ebola controversy in the United States. Thomas Eric Duncan was treated and died from the disease there, and 2 nurses who cared for him have the virus.
There were moments of triumph in the Ebola outbreak. Brantley and Wrightball were declared Ebola-free and released from the hospital.
Today is a miraculous day. I'm thrilled to be alive, to be well, and to be reunited with my family.
An experimental vaccine was fast-tracked, sent to Guinea, and performed well in early trials. It was later found to be 100% effective in protecting against the virus. The WHO